Hello, brothers. Good seeing you all today.
Good to be here.
As you know, I am the pastor of this great church, the historic Elizabeth Missionary Baptist Church. Has been in the Monroe community now for 137 years. And I've been here for 26 of those years. And it's been a great journey, great journey. I pastor a great group of people. And I'm glad that you all are here so that we can have a conversation, a very needed conversation about this vaccine and what we're dealing with in this pandemic. Again, I'm Moscow Gardine. You know that. I'm making sure you know that. But I want you to introduce yourselves so everyone will know who you are as well.
I'm Melvin Tate. I pastor Mount Calvary AME Zion Church, the oldest black church
It is.
in Union County. And I've been here since 2014. Have been involved in the community, see many opportunities to serve, and certainly the pandemic has caused us great concern, and we are excited about having the opportunity to address the issues that seem to be our issues to deal with in this time that we're in.
Yeah.
So it's good to be here with you, Dr.
Yes, sir.
Gardine, and good to be here with you, Dr. Keener.
Absolutely.
Well, I'm Stephen Keener, and I am a public health physician. Worked in public health my whole life, mostly in Mecklenburg County, but the last couple years I've been working part-time with Union County Division of Public Health. And the time that we are in right now with this disease, with this pandemic, has really drawn on public health. And of course, we're aware of the disproportionate effect of this pandemic on people of color and historically marginalized populations. And we're just very grateful that we can have this conversation today to help get facts and true information out to the community.
Well, there's obviously a lot of concerns, as you just alluded to, in the Black and brown community as relates to this vaccine. And this discussion is so necessary. I'm just grateful that you, Dr. Keener, and you, Pastor Tate, have taken time out of your busy schedules to have this conversation. And so with that said, let's kind of delve into some things and some issues that I think we both are very much aware of. And as the doctor in this group and involved in healthcare, perhaps you can provide some facts for us, as you said, and some answers to our questions. So with that in mind, I do have a question that maybe we can kind of get started with. So you are aware or must be aware of the misinformation and also the mistrust that is clearly among people of color. So my question to you is, what do you think we can do to help bring some truth and some facts to our concerns and obviously the distrust that circles our people?
Well, obviously, mistrust and misinformation are both real. Both of those things exist. I think it's probably easier to deal with the misinformation, which is one of the reasons why we're here today, is so that we can really talk about what the real facts are and kind of debunk some of the myths. With respect to the mistrust, that goes back a long time.
Absolutely.
And there's a sad history in this country of terrible treatment of people of color by the majority white population. And that's just hard to turn around on a dime. But hopefully, dialogue like this and reaching out to community is one way that will add to or start the process of trying to undo that mistrust and replacing it with trust. So I think that it's very important for those that are involved with this vaccine and the vaccination process to reach out and go out rather than expect people to come in And that's what we're trying to do here.
Good stuff.
Dr. Kana, a lot of people are wondering, will the vaccine prevent the transmission of the virus?
So there's really two things involved in that question. One is the prevention, and one is actually getting sick from it. Now, one of the basic tools that we have for prevention is those measures that we've all heard about, the 3 W's: wearing a mask, keeping distance 6 feet apart, which is really important, and washing hands. And that keeps actually the virus from spreading from me to you. What the vaccine does is really protects our bodies from the effect of the virus should we get infected with it. And so maybe that's easier understood as preventing serious illness. So if something is like a common cold and you get it and you get over it, it's not that big a deal. But COVID is not like that. For a lot of people, particularly with people with underlying conditions or who are in their later years, when they get very sick or they even die from it. So that's what the vaccine does. It really protects a person who's exposed from getting sick.
I want to pick back up on the misinformation, mistrust. Moderna seems to be the vaccine that's being given to people of color more than not. Is there any reason behind that? Because, it raises some suspicions.
Right.
Yeah.
So, there are 2 vaccines right now. There's another one getting ready to come, Johnson & Johnson. But the 2 that we have, Pfizer and Moderna, it's the same technology that was used. Basically, the difference is it's 2 different companies, and then there are some differences in how it's shipped and how it has to be stored. Pfizer has to be stored in ultra-cold storage, whereas the Moderna can be more like a regular freezer. So Pfizer's also shipped in much larger quantities. It's like 1,000 is the smallest amount you can get, whereas Moderna is 100. But as far as the vaccine is concerned, they're really the same thing. And I checked this morning in Union County, about 80 or 90% of what we have been shipped is Pfizer. So most people in Union County are getting Pfizer. And it just depends on what day you go. We don't know whether we're getting Pfizer or Moderna from week to week. So it just depends on what day you go and what vaccine is there. And we encourage people to take whatever vaccine is available because they both work great. And most people in Union County have actually gotten Pfizer.
Okay, so you're saying Moderna has not been used to target specifically
Absolutely not.
people of color? Okay.
Absolutely not. Whatever day we're giving Pfizer, that's what people get. Whatever day we're giving Moderna, that's what people get. Myself, I got Moderna.
Okay.
I've gotten my 2 shots of Pfizer, and I'd like to add that I've had no adverse reactions. Little discomfort the second day where the shot was given, 3 or 4 hours later was gone. Second time, the same thing. I've had no adverse reactions, but I've heard people say that they have had. I'm wondering if some of those adverse reactions are psychological panic attacks, or if people are really having the adverse reactions that they're saying they're having, because some of them are far-fetched and not all of them are the same.
Well, both of these vaccines, all of them really were tested for, the better part of a year before they were allowed to go on the market for the general public. About 70,000 people were involved in those studies. And what they found was that most common side effects were some soreness at the vaccination site, sometimes body aches, sometimes a little fever, sometimes joint pain, but those vary from person to person. I think the important thing to remember, though, is when you get a side effect, what that tells you is that is your immune system working. And your immune system working to build up strength so that if in the future you actually get exposed to the virus, then it's ready to go.
Well, you've admitted you've had your shots. I'm assuming two, and
Yes.
Pastor Tate has. I have not. I have not, and it's because I do have my concerns. I tend to think, perhaps like some, that the vaccine was produced very quickly. I don't know how long. I think you alluded to how long it must have been on the trials or it took to produce it, but it still seemed kind of fast to me. Typically, does a vaccine doesn't it take longer than it did in this case?
You know, in history, it has taken longer. But the vaccines that that we're familiar with, that, we give our children and that we get as adults, it's a different technology. The technology that's being used with these vaccines actually has been underdeveloped for a decade or longer. That is, they've been working on it for a long time. And what that allows is when a new virus appears on the scene, and this isn't going to be the last one. There's going to be more, because that's just the way things are right now in the world. But what they can do is it's fancy molecular genetics. It's called gene sequencing, and they can actually look at the genetic code of these viruses, and they can figure it out, and they can take a piece of it and use that to put in with this vaccine technology to make a new vaccine. So the fact that it was such a short time doesn't take into consideration the 10 or the 15 or the 20 years that this research has been going on. As a matter of fact, one of the developers of this whole technology is a black woman named Kizzmekia Corbett.
Yeah.
And she's from North Carolina.
Mills.
Yeah. And of course, that has been used to motivate African Americans to get the vaccine. Now, I want to be clear. Although I have not taken the vaccine, I don't fight it. I've had persons in our congregation and people that I know who've said to me, well, I had underlying health concerns, or my immune system is compromised, and I just felt it best for me to go ahead and get the vaccine. Well, to God be the glory. I have none of those health concerns. I don't even take the flu shot, just to be very frank with you. And so my argument has been, well, if I don't take the flu shot, why should I take the vaccine? But again, I don't fight against it. I think it's a personal decision. You have to consider your own health, pros and cons, whether or not you need it. If you need to safeguard yourself rather against the potential of getting COVID. But again, I have not had it, but I support anyone who believes that they need to take it. It's a personal decision. That's kind of my position on that.
Right.
Well, will I change my mind? Well, we'll see.
I would hope that my friend and brother would change his mind. I guess I'm a little more on the side of, I've always been curious. I'm a black man. I've had just about everything a black man can have, disproportionately, and the disparities aspect. I've had kidney cancer. I've from 1997, I haven't had that problem. I came here and had prostate cancer, and I had the great fortune of being referred to NIH, National Institute of Health at Bethesda, where all of this testing and trials and research is going on. I saw the young lady before she became famous, and one of the things that was said about her, she was the only one in a sea of white-coated men. She was the only one there. And she got inspired one summer by visiting University of North Carolina, Chapel Hill, a scientist who was a researcher. He's told her she could do what he was doing and do it better. So here she is at that time. And I think it's a great moment in history. I grew up in the era of polio, tuberculosis. So I'm familiar with the importance of vaccines. And by working with community health centers, I've been in communities with disparities and underserved communities. I think that from my standpoint, as a pastor, I feel obligated to make sure that the people I serve get the best quality of care, not at the back end, but at the front end. And so I'm always trailblazing and precursor and pioneering. I would like to think that we are at a space and time that the leadership realizes that we do carry an onus. So the reason I offered myself, I was not 75, and I kind of called and protested because I wanted the vaccination. I wanted it because I wanted other people to see me getting the vaccination. That would be one way to say that I was just not giving lip service, but real intentional service to let people know it was all right. I think that the past, yes, it has been with us, but we've come a long way since the medical apartheid issues that are realities. The thing that bothers me is we already know we are disproportionately impacted by the disparities as a people. What are we going to do to change that? Education, you have to deal with the issue, transportation, and like I shared with members of the health department, we have a beautiful health department, but some people have problems getting out to it.
Absolutely.
So, and poverty, people of poverty carry things a little differently. And this county and Monroe sort of lags behind the rest of the areas where household incomes are $85,000. You're talking about $20,000 and less, which means we have a real responsibility of breaking through these barriers and getting our people vaccinated so that they will have quality of life and long life, and that this virus will not just take us out because we are ignorant of the fact and listening to stories that aren't really true. So I'm glad you're here, and I'm glad we're here in the Black church because, and as Black pastors, we carry a major responsibility in getting the word out.
You're exactly right. I think first of all, I think it's great that of the two of you, one has gotten and one hasn't, because this shows two approaches.
Sure.
Because maybe you will decide to get it later.
Well,
and I hope you will.
Perhaps so. I'm going to ask a question though about that. So for a person, and I give God all of the glory for this, I'm healthy. I try to do my part, obviously, but Lord's been good to me, and so I don't take any medication, and so I don't have any problems that I'm aware of, and I just had my annual about a month or so ago. My doctor said everything's good. I said that's a good report. So what do you say to a person who doesn't really have the health challenges about getting this vaccine? I understand if you have underlying health concerns, it probably just makes sense to do that. But for the community of people who don't, it's a tough sell to get us to get vaccinated. So what do you say? How do you make the determination?
Well, there's two things. Number one is the message. That's what we're here for.
And I don't fight against it. I want to be clear.
Yeah, and the other one is the messenger.
Yeah.
And both of those are very important. But to your question, I would say that that certainly a person in good health is going to be in group 5, that last group that would be eligible for the vaccine. It does give you more time to think about it. And of course, the more people that get vaccinated, the more time that goes by, and the more we see, are able to observe what issues, if any, pop up, then that would hopefully inspire confidence for other people to say, okay, well, my friend, my family member, so-and-so, my pastor, maybe this is a good thing for me. But I don't believe that there's anything inherently wrong with people just to blindly go and get the vaccine. I think it's important for each person
Say
to
that
do
again.
their.
You don't believe?
I don't think that it is necessarily wrong for people to not blindly go and get a vaccine without thinking about it. If they want to do that, that's fine. But if somebody wants to take a little bit of time and study it and talk to people about it, get more information, get facts, wait, I think there's not a problem with that, as long as they continue to take the necessary preventive measures that we talked about,
I
3
agree.
W's.
Yes.
Even healthy people need to make sure that they are masked, that they stay 6 feet away, and they wash their hands a lot.
Of course, and that's why we're sitting 6 feet away from each other now.
Exactly. Exactly.
The owner, I hate to be, I won't say the word the phrase that goes with this, but to talk about healthy people, 70% of the people that I've heard that are friends of mine that are no longer with us were healthy people. There's this thing, symptomatic and asymptomatic. But we don't know when and we don't know where we come into these contacts. And I think that that's the important. The more people we have vaccinated, at least we have the assurance that it won't be as severe. But the thing that bothers me is that there are too many people that are not taking advantage of the opportunity to be vaccinated. And I think
That want to be or not, or just in general.
No, I think that they are fearful because of what they hear. And listen, there are enough people that are afraid to take shots.
Period.
IVs.
Yeah.
So what I'm saying is that we have to try to hurdle over those phobias and those fears and get to the reality we have this pandemic in the world like we've never seen it before. Look at the number of deaths. Look at the number of people who have contracted disease. Look at 500,000 people in America. That's more than heart attacks. That's more than the wars.
Yeah.
So what we've got a serious issue. And I don't think, I believe in favor. I believe in grace.
In faith.
I believe in God.
Yeah.
But I also believe that we have to face our social realities, the things that are part of the playing field. And I'm not being a doctor, but I'd like you to address it. We have to acknowledge the climate, the environment that we're in. And it is a different environment.
So let's talk about that, because before this virus came on the scene, nobody had ever had it before. Nobody had any immunity to it. Doesn't matter how healthy you are. If you get exposed to it, you're going to get it in your body. Now, we know that younger people don't have a bigger problem with it, asymptomatic, like you said, or some people maybe have a mild illness. But then unexpectedly, a lot of people have serious illness, and the statistics about death don't lie. So because this is a new disease, the only way your immune system can develop an immunity to it is one of 2 ways. You have to get it and survive, or you have to get vaccinated. For me, I like my chances better with the vaccine. And, maybe everybody doesn't feel that way. It's something that everybody has to weigh for themselves. But as a physician, my recommendation is for people to take the vaccine because it is effective, it is safe, and a person just does not know what's going to happen to them if they actually get the disease.
Dr. Keener, could you talk a little bit about another thing that the vaccine changes your DNA, mRNA?
Yeah.
Does it change your DNA?
Right. That's a really great question, and this goes back to the technology that I was talking about, the development of these vaccines. And it does use a little piece of mRNA, which stands for messenger RNA. Of course, people know that our genetic code is DNA,
Right.
and that's how our cells divide. The DNA is inside the nucleus of the cell, which is kind of a separate little place in the center of each cell. The mRNA, while it gets manufactured inside the nucleus, it passes out of the nucleus, and then it actually starts manufacturing the proteins that the cell needs to survive. The mRNA does not go from the interior of the cell into the nucleus. That's backwards. So the mRNA would not ever have the opportunity to meet up with the DNA. So it would not change our genetic code. What the mRNA does with this vaccine is it starts manufacturing proteins which are responsible for the spikes on the surface of the virus. And so then when the immune system sees those spikes, that's what it reacts to, and it goes into a memory. So if the immune system ever sees those spikes again, then it's going to attack it. But we're basically kind of fooling the immune system into making it think that it's seen the virus when actually it's only seen the spikes.
Are you aware of any cases of persons who have gotten the shots, the vaccines, and still got COVID?
I am not specifically aware of it, but any vaccine is not going to be 100%. Now, the Moderna and the Pfizer vaccines are about 95% effective. I think 194, one's 95.
97, one's 97, one's 94.
The Johnson & Johnson is slightly less than that,
72.
but there will probably be some people that would still get infected with COVID. But here is another advantage of the vaccine, is that if you do get it, it's going to be a milder form of the disease and likely will not cause death. So we're trying to keep people from getting sick, but we are particularly trying to prevent serious illness that requires you to be in the ICU on the ventilator and prevent deaths.
So I had a member to say, well, Pastor, if the majority of the country get the vaccine, I don't have to. I think they call it herd immunity or something like that.
That's herd immunity.
So could you speak to that if you don't mind?
Sure. Well, so the percentage of a population that you need to have vaccinated to create that herd immunity, what that means is that enough people are vaccinated that the virus just doesn't have anybody to infect.
Okay.
So your chances of coming in contact with it are very, very small. Doesn't mean you can't get it
Right.
if you are in the wrong place at the wrong time.
Yeah.
But the chances are very unlikely. And I think Dr. Fauci up at NIH said it for COVID, it's about 70%. So if 70% of the American population got vaccinated, then we would see basically there wouldn't be that many cases because the majority of the population would be protected. So what you say is true, but everybody can't say that. Everyone can't be the one to say, well, everybody else is going to get vaccinated. So I do think it's one of those things that an individual needs to consider when thinking about this is, am I going to contribute to being a part of the herd that's protected, so that we can get rid of this pandemic.
I was noticing that this just came to Mecklenburg and Union, and deal with your concern. As a nation, we're not a closed nation. There are still people coming from other quarters of the world, people coming from other states.
That's right.
Through past New York is a classic example. Our numbers weren't too very far from Mecklenburg, the people who have contracted. And is that because the traffic in between the two counties, South Carolina, Union County, and Mecklenburg, is that?
So Pastor, what you say is absolutely correct. This is a global pandemic, and if everybody on Earth doesn't have the opportunity to get vaccinated, we're all still at risk, because we have such a mobile population now. So much world travel. I mean, we can go any place in the world within 24 hours. And here locally, many people have family members that live across county lines or even state lines, and they go back and forth all the time. It's one of the great benefits that we have here, being able to move about freely, not only because we can, because we have automobiles and that type of thing, but also because we are politically free to do that. So sure, as long as there's people, someplace else that aren't protected, it puts people anywhere at risk.
So let's talk about the numbers specific to Union County.
Sure.
Where are we in terms of race, as it relates to those who've gotten the vaccine versus not?
So the African American population in Union County is about 13%. As a comparison, we know that the African American deaths in Union County about 16%. So that's a disparity there. As far as vaccination goes, we know real close to 10% of the African American population in Union County, to the best of our statistics, have had their first dose. And it's about 6 or 7% for the second dose. So, we're getting there.
That's higher than I anticipated.
It's a glass definitely half full. If you want to look, I look at it half full, not half empty. But we would like to make it full. So we're making good progress, but we have more to go. That's why we're here.
I'm assuming you also have statistics concerning the Spanish-speaking population.
Yes. I don't have those numbers right off the top of my head, but it's the same pattern. The deaths and serious illness in the Hispanic population is disproportionately larger than the proportion of population, and with respect to vaccination, it's less than the population. So there's a disparity both ways.
I'm sure.
And so similarly, we're reaching out to our partners in the Hispanic community. We're trying to identify natural leaders in the community, as we have you gentlemen, and provide facts, information, things that they can share with their friends, family members, and community members, to get the facts out, and using messengers that are trusted.
Okay, so just before, because I want to follow up on that. So Pastor Tate and I both have connections also to the Hispanic community rather, and opportunities to also share with them our opinions about the vaccination. What about the undocumented persons because they would probably be fearful about coming in for that very reason.
Sure.
Yeah.
So we, in public health, actually there is a federal law that forbids us from asking, and we don't ask. If somebody is a patient or a client in public health, they are eligible for all the services that we have just because they have presented themselves. Now, some of the social services may not fit into that category because you have to be, a citizen, you have to have a social security number, something like that. But for a pandemic, for something like this, if you are a walking, breathing human being, then you are afforded the same information and the same opportunity to receive this vaccine as anybody that works on the top floor of a bank. And that's exactly why we are trying to work with leaders in the community so that they will, I tell this to my patients very often. Look, yes, I work in public health, that's government, but this is not the part of government that is spying on you or going to try to pick you up and have you sent somewhere else. We are the part of government that is providing a necessary and beneficial service to you just by virtue of you being here. And we don't talk with those people. There's going to be no consequence to you as a result of your being here to take this service or to have this vaccine. So that's it.
Okay.
There was a thought just came to mind. Charlotte just tore down, they closed down, shut down their homeless site that was right there near Center City.
Yeah.
We have people who are in the woods, so to speak.
Right.
We've had some contact through feeding, I'm sure, yesterday.
Yep, absolutely.
But there are people that we don't know their names, but they come, we feed, we try to provide food.
Right. They don't have an address.
They don't have.
Yeah.
Will there be an attempt to, since we know where these places are, will they?
Absolutely.
Okay.
And I'm glad you brought that up because the new vaccine that's just coming, Johnson & Johnson, is only a 1-dose vaccine. So that one, and it also doesn't have to be refrigerated. So that one is much more, a much better product to take out into a community. And whoever is there, we can give it. And homeless populations will fall into group 4, which is the same population as people with chronic conditions, just because they're at risk for some of those chronic conditions. So this was an excellent point because, we only have to see somebody one time, we can give them the vaccine and they're protected.
Help me understand, Dr. Keener. It seems like two extremes as it relates to the vaccines. You've got Moderna and Pfizer. It has all these requirements of temperature, et cetera. You're saying the Johnson & Johnson don't have those same requirements?
Yep.
Seems like two extremes to me, which me personally raises another issue. Why? I think is the question.
It's the Johnson & Johnson is a little bit different technology, and it's one that's also been around for a long time. But because these two, the Pfizer and the Moderna, are the first ones to kind of be mass produced for the public, they are being super cautious. And I think that the Pfizer, which is the one that needs the super cold, the dry ice, there is some research that is showing, well, maybe it doesn't need to be kept that cold. They're doing some studies about that right now. So it may just be because this is the first time they are being extra cautious because they don't want any of it to spoil where we couldn't use it. But the Johnson & Johnson is one that is going to be very useful to have for other parts of the world where the conditions may not be like, may not have, cold storage freezers readily available. May be going out to villages or, up big tall mountains that are hard to get to, and it's only one dose.
Dr. Keener, it sort of seems like in the scriptures there's the parable of the Good Samaritan. It sort of seems like you've become a Good Samaritan, and look like I need to be contagious. I need to be a Good Samaritan, and Bishop needs to be a Good Samaritan. And I guess we're going to have to gather a cadre of Good Samaritans to get this word out. Do you think that effort is worth the effort to get the word out to the population that's being impacted greatest by the disproportionate disparities in health?
Well, it was certainly worth it to the Levite.
Great response.
And I do believe, even if it's a small number, then the effort is worth it, because anybody that is benefits from that will have a story to tell somebody else.
Well, I want to say whatever I can do, I'm all in, heart, soul, all of me, to help to bring about a transformation from the pandemics. I'm trying to take the sting out of the pandemic, if you will, and that death will not be the norm. That's what my desire is, and I'm here to serve.
A comment and then a question. We here in our ministry are virtual, and I'm grateful for our viewership. We get really, really good numbers week in and week out. I want to be clear when I say that I am absolutely advocating for this vaccine for those persons who need it, and believe that they have some challenges which would actually cause them to need it even more, health concerns. And then for those who are kind of on the fence, based on what you've shared and based on what I think I've learned and have researched about it, go get the shot. I am so not against that at all. I just haven't come over yet. And notice I did say yet, because in previous conversations, I was an adamant no. So this has been good. So please know that we're doing our part to keep the community informed. Every correspondence that I receive from the health department or wherever, I make sure that information is shared with our membership and our viewership. So know that I am an ally. I just haven't taken the shot yet. So here's a question as to maybe why I haven't. Do you think that the vaccine is effective against these variances that are coming out?
It's a good question. And it's something that's being studied right now. There isn't any evidence so far that they don't work against the variants. And by that I mean that there don't seem to be any people there's not a sudden rise in illness in people that have taken the vaccine. And we do know here in North Carolina, we know that we have two of them at least, the British one and the South African one. And there's another one from Brazil that has been found in some states. It may be here, we don't know. We also don't know to what extent those are circulating in North Carolina. We're getting, doing a little testing here and there. So they may be out there already, but it doesn't seem to be causing serious illness and death in people that have had the vaccine. Now, one of the advantage to the technology that exists is that if there is a mutation or another variant that does do that, they're able to, snip out that little sequence of the gene and splice it in there and, change the vaccine just about on a dime like that and start production of the new vaccine. So, we have to thank Dr. Corbett and her associates for that. But right now, these variants, the thing they're noticing about them is they just seem to be more infectious.
Yeah.
And that's why Dr. Fauci says we need to get more people vaccinated, because the more people we get vaccinated, the less opportunity that the virus will be able to change or turn into a variant.
Okay, so I thought that was my last question.
Yeah.
Once you've had the vaccine, are you going to have that re-administered every so often? Is it going to be a 5-year cycle, 10-year cycle, 1-year cycle,
Nobody knows the answer to that question right now, and it just depends on what happens with it. But, I think the experts are saying, let's get ready for this to be around, kind of like influenza is.
Oh, really?
Where, of course, the main reason why we have to get a different flu shot every year is because it mutates, right? And so, hopefully that won't happen with this one, but what the need for a booster shot is going to be in the future, we just don't know yet. Yeah. We have to wait until we have more people taking the vaccine and living with it for a while to kind of see what happens.
Well, let me say thank you, Dr. Keener, for coming and spending this time with me and Pastor Tate. We're going to, I guess, prepare to wrap this up. You've taken time out. You've answered a lot of our questions. If there are other questions that we have, can we simply reach out to you or
Absolutely.
Whoever?
Absolutely.
We would appreciate that. But again, I thank you. I think information is important.
I think in closing, I'm going to make myself the missionary in charge of dealing with this minister to become a vaccinated bishop.
I'm sure you will. But again, thank you. And thank you, Pastor Tate, for coming and spending this time here.
Thank you for this opportunity.
Thank you for your
And thank you
ministry
for your
in the
time to
community,
share with
and
us.
thank you for your time.
Absolutely.